when we are talking about the occupational diseases and work injuries in WHO European region, it is important to emphasize the fact that a severe under-reporting is present, and we don't have a clear situation. Some statistical data from the EU member states are relatively accurate, and there is a regular reporting to the Occupational Safety and Health Agency for EU member states, but in general the situation in 53 WHO European member states, including the European Union member states, we can say that a severe underreporting is present. Moreover, in many member states it is not only that it is not reported, it is quite often that occupational diseases and work injuries are not even identified, they are not diagnosed, and then they are not recognized as occupational diseases. In general, it is important to say that NCD epidemics is contributed through the factors from the living and working environment, and the most important things are the fact that all occupational cancers are avoidable. So, talking in terms of the data, we can say that in general NCDs also related to the workplace are highly rated. Then musculoskeletal disorders, hearing loss, etc. On another hand, I would like to point out that all occupational cancers are preventable, and today at the workshop we are dealing with the asbestos-related diseases, and they are all NCD category, starting from asbestosis and other changes in the lungs to the most malignant changes like mesothelioma, and then larynx, carcinoma, and even stomach and ovarian carcinoma. So this is why we are dealing in the region, especially with the asbestos-related diseases as one of the deadliest occupational carcinogens. The activities related to the improvement of the working conditions are very much related to the fourth pillar of the Health 2020. Talking in terms of NCD prevention and control, also these aspects and activities related to NCD prevention and control are also very much linked with the interventions that can be done in improving working environment. So that would be in brief. In general, it is important that multi-sectorial approach is applied, that in elimination and the control of occupational diseases and work-related diseases, there is an established dialogue with the employers, with the workers' representatives, trade unions, but also with academia, and with the health care authorities to use health data to promote the development of the protective policies in the health and safety area. Workers' health protection is the area which requires traditionally, and it is set up this way also at the international level, a close cooperation, as I have already mentioned, between the representatives of the employer and of the applying scientific evidence in policy development. So the next steps should be to improve access to decent work, as this is SDG 8. but also under SDG 3, as the new framework of 2030 development agenda, is health for all, so that all the workers have the access to basic occupational health services. Today we are facing with a huge amount of migrant workers, of informal workers, of self-employed people, of agricultural workers who are not covered by occupational health services. And this is the biggest public health challenge. It should be also a good motive for the employers to provide such services, and it should be, of course, the obligation of the employers according to ILO conventions, numerous ILO conventions that are dealing with these issues, because only healthy workforce can be productive and can contribute to the economic development. So I think a reinforcement of such an approach, which is partly forgotten, is important today, and access to basic occupational health services is essential for all employed people.